Hello and welcome to today's episode of Focus Atlanta. I am your host, Keisha Lancelin. Thanks so much for tuning in with us this Sunday afternoon. In our first segment, we're going to talk a little bit about detecting early Alzheimer's, and I am here with Dr. Alfasi. Thank you so much for making time to come on the show today.
Well, thank you for inviting me.
Absolutely. Well, are there things that we can do to learn more and to keep ourselves fully educated about what we need to know about early Alzheimer's?
So as we are progressing and getting more knowledge about Alzheimer's and memory loss, and especially as our population is aging, as the boomer population is getting up there, we're just discovering a lot more about, and it starts off with mild cognitive impairment, and then it can go and progress into Alzheimer's and dementia. But in order we're all going to experience some memory loss as we get a little bit older, such as where did I put my keys, or what was that last thing on the grocery list? That's normal. But yeah, I think it's very important to educate ourselves and the population and people about my age, as our parents are aging, about things to look out for early memory loss.
Well, are there signs that we could be looking out for?
Yeah, so as we age, there are certain normal things that we are going to forget, such as that last item on the grocery list or where you put your keys. That's completely expected. And sometimes we end up having some difficulty remembering maybe a person's name when you're out at a party. You just can't really find that one last name, one last detail. But things to kind of look out for is if you walk into a room often and you forget why you went there, or if you're having trouble recalling a party that you went to or an event that you went to the week before, or if you find that your loved one is repeating the same question and you answered them not too long ago and they're just kind of keep repeating, that's something to be on the lookout for.
You know, so often we think of a certain age range when we're talking about Alzheimer's, but it seems to be happening earlier and early. Can we talk a little bit about what age range we should be expecting?
Yeah, so there are definitely two different age ranges. One Alzheimer's type is due to genetic causes. So in that scenario, you will have a parent who's gone and experienced Alzheimer's disease, or a grandmother or an aunt. In those scenarios, you're more likely to experience earlier Alzheimer's. So in those situations, maybe 50s, even sometimes as early as 40s. But a lot of those people tend to have predisposing diagnoses or reasons, or maybe they've experienced head trauma when they were younger, or a car accident or something like that, or the genetic factors. Then we get into the fact of some people, our population, we figured out how to let people live a really long time, and they're naturally going to have an accumulation of what we call either, we're doing more research, but amyloid plaques or tau protein accumulating in their brain, and that is we're starting to understand how that can contribute to memory decline and Alzheimer's. So there's definitely two different routes that this can go.
In terms of prevention, I think that's the other thing that's frightening for people. There is no cure. There is no way to prevent. What are you telling patients, or what are you telling family members about things that they could do to perhaps stave it off a little longer, or have a healthier brain? Is there anything?
So we're still working on it, right? We're still doing lots of research, and we're still we've made so many big leaps and bounds in the last decade, but there's still much more to go. I think the best thing is to stay active and stay engaged. So a lot of times as people enter retirement age, and I think we're realizing that people like to work a little bit longer, it's important to keep up those social interactions. Go meet up with some of your lady friends and play some mahjong, or go to take some cooking lessons. It's important to stay active, do exercise, lift weights, and then eat healthy, trying to kind of maintain a healthy diet. As for if you're experiencing Alzheimer's symptoms, then that's where medications can come in, and that can help slow the progression of your Alzheimer's.
Thank you so much for making time for us today and kind of setting our minds at ease. I think that when we're better educated, we can better approach these things in our lives and the lives of our family members. It was a pleasure to meet you.
It was very nice to meet you too.
All right, guys, we don't have to be so afraid. It's the unknown for many of us. Learn more, and then we can maybe do a little better just in our lifestyles and the things that we do every single day. Thanks, guys, for tuning in to this segment of Focus Atlanta. We'll be right back with more.